Pnawn da, a chroeso i'r cyntaf o'r sesiynau briffio rheolaidd Llywodraeth Cymru i'r Wasg fydd yn cael eu cynnal ar ddydd Llun. Eluned Morgan, dwi Gweinidog newydd Iechyd a Gwasanaethau Cymdeithasol Cymru. A gyda fi mae'r Prif Swyddog Meddygol, Dr Frank Atherton. I'm Eluned Morgan, the new Minister for Health and Social Services, and with me is the Chief Medical Officer, Dr Frank Atherton. I'd like to start with some personal reflections. Like everyone else in Wales, I've watched our NHS and health and care family do extraordinary things throughout this pandemic. No part of our system was unaffected. The shadow of this virus has been felt by those accessing care and by those providing it. We've seen professionalism, dedication, and innovation. People have adapted to respond to unprecedented workloads. We should all recognise the emotional impact of caring for people who were forced apart from families and loved ones, of delivering difficult news by telephone, and of being there when a family could not be. Our phenomenal vaccination programme is delivering hope and a pathway out of this pandemic. Well over 2 million people have had their first dose, and we reached the milestone of 1 million second doses this weekend. Every single vaccination is a small victory against the virus. Diolch yn fawr i chi gyd am eich cydweithrediad. I look forward to working with partners to lead our health and care services out of the pandemic, to build on the extraordinary innovation that we've seen and to recover the services that we all depend on every day. As we turn our attention towards recovery, we should be under no illusion that coronavirus is still with us. The Chief Medical Officer and public health experts are constantly monitoring its spread and advising us as ministers on the right measures to take to help keep people safe. And Frank will say more about this shortly. Mae'n bwysig ein bod ni yn wyliadwrus wrth i ni ail-agor yn economi gan wybod fod yr amrywiolyn newydd yn gallu ymledu yn gyflym. Coronavirus cases in Wales remain low. This is very good news, and it's thanks to the efforts of all of us who are following government guidance. However, we must not be complacent. We must keep our distance when we're out and about, isolate and get tested if we have any symptoms at all, wear our masks, and when we need to take up the offer of both doses of the vaccine when we are invited. We've come a long way. The path has been difficult and our success has been hard won. We'll need to carry on with these everyday precautions for the time being in order to keep cases low. There's been a lot of attention on international travel over the past few days, and in the recent miserable weather, it's understandable that many people will be tempted by the promise of sun and holidays abroad. But we would strongly ask you not to travel just yet. You should only go abroad if it's absolutely essential. Otherwise, we risk bringing the virus, or more worryingly, a new variant back home with us to Wales. Now, in a moment, I'll talk about my most immediate priorities as Health Minister, but I'd like to bring in the Chief Medical Officer to update us on the current picture in Wales. Diolch, Frank.
Diolch yn fawr. Thank you, Minister, and congratulations on your appointment. As you rightly say, the cases of coronavirus here in Wales do remain very low, about 800,000 at the moment, the lowest of the 4 UK nations. And that's really good news. But of course, as we've seen repeatedly throughout the pandemic, there are lots of uncertainties and things can go awry very quickly if we take our eye off the ball. So there's very good reasons for us to continue on the cautious approach that we've set out and have followed here in Wales. As the Minister mentioned, we're keeping a very close watch on the so-called India variant, the variant that was first identified in India, B617.2 it's also called. But there are currently around 57 cases that have been identified here in Wales. So the number is going up and has gone up over the last few days. So it's something that we need to watch very carefully. And our response has been really managed through our local public health teams and the incident management teams that they establish. And they're doing an excellent job in tracing, in testing, and in promoting vaccination in areas where we are seeing the variant being transmitted. The aim here is clearly to break those chains of transmission so that we don't get widespread community transmission here in Wales. Well, why do we worry about variants, any variants, including this one? We worry about it because variants can be more transmissible, and we believe this variant is. We worry about them because there is a risk that the vaccines may be less effective, and we worry about them because potentially they could be more virulent, which we don't think is the case with this particular variant. So we continue to work intensively with colleagues across the UK to get a better picture of just how transmissible it is and how well the vaccines are going to support us. We recognise that variants come in from abroad, and that really speaks to the Minister's point, and it's the clearest possible evidence that we have that the Welsh Government's position, which is very clear about international travel and has been set out by the Minister, that we should only be travelling internationally if it's absolutely essential. And here, closer to home, it's really important as well that our advice is understood and is very clear. It continues to be clear. We have to proceed cautiously with the relaxing of the restrictions that we have in place here in Wales. We have to keep a very close eye on case numbers and rates, and we have to make sure that everyone understands that that there are things that absolutely we can all do in order to keep ourselves and our loved ones safe. And of course, when our call comes for it, it's important that we go and get our vaccination on time. So thank you very much, Minister.
Diolch yn fawr, Frank. Now I'm going to set out some of my key priorities as the new Health Minister. So along with containing the virus, NHS recovery is my absolute key priority. Low community prevalence has translated into an improved position for the NHS, and for this reason, it's important to set out how we can continue to increase NHS normal activities. Now, I've already announced £100 million for equipment, staff, and to improve services, to increase capacity and to cut waiting times. And this is just the start. No one should be under any illusions about the task ahead of us, but the pandemic has shown us how we can act quickly when we work together. We need to be ready, we need to do things differently, and we need to embrace change if we want to speed up the system and alleviate pain for thousands of people. We'll support our NHS staff and give them what they need to make sure that people waiting for treatment don't wait a day longer than they have to. Now, one area that particularly concerns me is so-called long COVID, people who've recovered from the virus but still suffer after effects for many weeks or even months. Those struggling will not be left without support. Long COVID affects all ages, which is yet another reason why we need to keep cases as low as possible, of course. The pandemic has turned our lives upside down and has had a huge impact on our mental health. I'll ensure that people who are struggling get the support they need when they need it. And I'm delighted that my colleague Lynn Neagle has been appointed as Deputy Minister with specific responsibility for mental health. She's been a long-standing and hugely effective champion in this area, who I'm sure will make an immediate and lasting impact on our approach to mental health. Becoming Wales's Health Minister is an honour and it's a huge responsibility. I'll do my best to look after our NHS and our care system so it can continue to do an incredible job in looking after us all. Diolch yn fawr. I'm now happy to take questions from journalists, and as usual, all the answers will be broadcast live on social media channels. Felly, cwestiwn gyntaf oddi wrth Thomas Evans S4C.
Diolch, Gweinidog Iechyd, pnawn da i chi. Ydych chi sôn fyna am rai o'r heriau sydd yn wynebu'r gwasanaeth iechyd yn sgil y pandemig. O ystyried bod y gwasanaeth iechyd yng Nghymru yn wynebu heriau sylweddol cyn y pandemig hefyd, beth allwch chi i wneud i sicrhau adferiad llawn i'r gwasanaeth iechyd yn dilyn y pandemig, a sut fyddwch chi yn mynd ati i gyflawni hyn?
So Thomas was asking me how we can go about recovering in terms of waiting lists and how we can really tackle the issues that have arisen as a result of the pandemic, people waiting for long times. What are the plans on that? I ni wedi sicrhau ein bod ni wedi cyflwyno cynllun. Mae ni'n eitha bras ar hyn o bryd, ond fydd fwy o fanylder yn dod yn y fan. Ond mae rhaid ni sicrhau ein bod ni'n gweithio mewn ffyrdd gwahanol. Falle defnyddio technoleg yn fwy, defnyddio ffurfiau digidol i gysylltu gyda pobl. Ond hefyd fydd rhaid i ni ceisio meddwl mewn ffordd gwahanol. A dyna beth dwi wedi gofyn ac awgrymu un gwasanaethau iechyd ni i wneud. Felly, i ni yn gobeithio wrth i ni roi fwy o arian mewn y system, fydd fwy o obeth i'r pobl yna sydd yn dioddau ar y rhestru aros. So we have made sure that we have pumped £100 million into the beginning of our recovery of the NHS. We're aware that there are thousands of people who are struggling in pain in Wales, and we're determined to tackle this issue. We've already set out a brief version of how we plan to tackle the issue of recovery from within the health and care system. We will, of course, be asking people to embrace technology as they have done so effectively during the pandemic and the digital solutions that have been available to them. We'll only be able to tackle this, however, if we work in partnership together, building on the cooperation and teamwork that we have now become famous for within Wales. I think it's only in that way, by acting differently, by acting radically, that we'll be able to tackle the backlog.
Diolch i chi. Ac wrth i'r amrywiolyn a gafodd ei adnabod yn gyntaf yn India fod ar gynnydd mewn rhai mannau, ac yn ystod cyfnod hefyd lle mae'r rheolau a'r cyfyngiadau yn cael eu llacio, a falle llai o sylw yn cael ei roi i sefyllfa'r coronavirus yn y cyfryngau, ydych chi'n bryderus na fydd y cyngor iechyd cyhoeddus yn llwyddo i gyrraedd y cyhoedd yn yr un modd dros y misoedd nesaf?
Thank you. Thomas was asking whether, despite the fact that the Indian variant is now becoming slightly more prevalent in our communities, whether we have concerns about relaxing our restrictions at this time, and whether the messages from Public Health Wales will get through to the public. Mae'n bwysig ein bod ni yn deall y bygythiad gallai ddod fel canlyniad i'r amrywiolyn newydd yma. A dyna pam mae'n bwysig bod cymaint o bobl a sy'n bosibl yn cael y frechlyn. Wrth gwrs, mae'n gyfrio'r pryd i ni'n llacio ar y cyfyngiadau sydd wedi bod gyda ni ers dipyn o amser. Ond i ni yn gobeithio y bydd pobl yn gwrando ar y cyngor sydd yn dal i ddod oddi wrth Iechyd Cyhoeddus Cymru, a bod pobl yn dilyn y canllawiau sydd wedi i setio allan ar gyfer y rheini sydd wedi cael y cyfle erbyn hyn i ail agor. So, of course, we're very aware of the Indian variant and the additional threat that can bring, particularly at a time when we are relaxing the restrictions. But I am confident that the people of Wales will behave in a way that they have done throughout the pandemic, that they have followed the guidance that we've set out, and of course that guidance is clearly set out. We'd expect those people who are responsible for opening up our pubs, our restaurants, our hospitality, our tourism sector to follow the guidance that has been set out, and I'm sure the public will adhere to that advice. Ellie Pitt from ITV Wales.
Thanks so much, Health Minister. First of all, how concerned should the public be that the so-called Indian variant and any other variants that may follow will prevent or delay the recovery of the NHS and its return to something that the public might recognise, especially when it comes to things like visiting people in hospital or waiting times, as we've discussed?
I'd just like to ask Frank to touch on the Indian variant a bit more, if that would be possible.
Well, what I would say, Ellie, is that the public should be worried about the resurgence of coronavirus in general, really. We have a small number of cases, 57, at the moment of cases that we've identified of the India variant, the so-called India variant. That will be an underestimate. There will be other cases, and I do expect those numbers to rise, but they're still small, in the scheme of things. And as the Minister was saying, the things which have, brought the numbers right down here in Wales, those things that we've become accustomed to about social distancing, about hand washing, about face coverings in public places, those are the things which will keep us safe. And anything which puts that into reverse, to rapid relaxation, the introduction of new variants from overseas, all of those things, raise the risk that we could end up going backwards. So we need to avoid that. And the numbers are small at the moment. We're watching them. We're keeping a very close watch on them. But we just need to be cautious as we reopen society.
And Ellie, there is, of course, a way that people can help us with that, and that is that they take up the offer of the vaccine when it's offered to them. We're at a state now where we've got 80% of adults in Wales who've received their first dose. We've got a third of adults in Wales who've received their second dose. Even 50% of people from 18 to 29 have received their first dose. So we're really doing incredibly well in Wales, and that's the best way, I think, for us to really deal with this new variant that is causing some concern among scientists at the moment. But we do, of course, hope that we will, despite that, be able to work towards a better state of normality within the NHS. Of course, we'll have to take some very clear precautions, and we'll continue to take advice on that. But we are starting on that journey of rebuilding the NHS following one of the most traumatic periods in the NHS's history.
Thank you very much for that. Secondly, I want to pick up on your point that you made about those suffering with long COVID and the after effects of having the virus. You mentioned there that there will be plenty of support for people who are dealing with that situation, but I've spoken to one woman who's found support to be quite evasive. I just want to know what guarantee you're going to give people like her that that support for recovery, her own personal, physical and mental health recovery, will be forthcoming.
Well, I've just been in the job for over a week, and this is an area that I have asked my officials to really focus on. I'm very aware that there are literally tens of thousands of people who are suffering with long COVID in Wales. I think this is an area that I do hope to give some attention to in the next few weeks. Of course, I'll be very anxious to hear from people who are suffering from long COVID, but we will be doing things in the Welsh way. We'll be doing things in a way that is right for us, responding to local circumstances. So in the next few weeks, we'll be building up a plan of action in relation to how we tackle long COVID within Wales. Mark Smith, Wales Online.
Thank you very much indeed, both. Wales is now dramatically ahead of the other nations of the UK in delivering first doses of the vaccine, but is slightly behind on second doses. Is that a deliberate strategy, and are you likely to perhaps change that now, given the evidence about the importance of the second dose in protecting against the Indian virus?
Thanks. We've had some quite extensive discussions on this. I'd like Frank to address this, if you don't mind.
Yeah, thanks, Mark. You're right that Wales has been ahead of the other UK nations in terms of the proportion of people who've been given a first dose. It's just a consequence of the supply chain and the timing of vaccines, which has led to the fact that the second dose has been slightly less. That will catch up in time. Over the next few weeks it will catch up, and we expect that it'll be about the same. The reality, of course, is that we're all in the UK aiming for the same point, which is to get to the whole of the adult population vaccinated by the end of July, and we are currently on track with that. As long as vaccine supplies hold up, which we have no reason to believe they won't, we should be able to achieve that. And as the Minister has rightly said, we have really quite good coverage rates, even down to the younger groups, of course, who are the groups who are mostly affected by the variants that we're currently seeing.
I'd just like to pay tribute to all of those people who've been involved in the vaccine rollout. It's a real testament to the kind of teamwork that we've seen in Wales, the Welsh Government working with health boards, with volunteers, with representatives of the armed services, all working together. We've also given a lot more autonomy to local groups to be able to flex and adapt to the conditions locally. And we've made a principled decision right from the beginning that the best place to store vaccines is in people's arms. And so that has been an approach that I think has been vindicated in terms of the Welsh Government's decisions. Mark, did you have a second question?
I do indeed. Thank you very much. Scotland is banning travel to and from 3 Indian variant hotspot areas of England. Are you considering a similar move in Wales? And obviously, Dr. Atherton, you mentioned the fact there are now 57 cases of the Indian variant in Wales. Would you be able to give us some idea, I appreciate the numbers are small, but of where exactly in Wales the main concerns are and where it's the most widespread?
Again, Frank, are you happy to take that?
Yeah, of course, yeah. So of those 57, the majority at the moment are in Cardiff and Vale Health Board. In fact, all health boards have seen cases of the so-called Indian variant, except for Powys. The biggest number is in Cardiff and Vale. The important thing is that these are, in Wales, all traceable back to a point of entry. So we're managing them as clusters, and that's a really important point because if we look across the border into England and certainly up into Scotland, Glasgow area, what seems to be happening there is that there is broader, widespread community transmission, and that's a much more difficult thing, of course, to contain, whereas here in Wales we're managing them as clusters around points of entry. So we've seen cases, as I say, in Cardiff and Vale, we've seen cases in Swansea Bay, a small number of cases up in the north. So they are dotted around in Wales with a specific clustering around Cardiff.
We haven't made any decisions to restrict travel to those hotspots in England as a government, but obviously we will be constantly keeping the situation under review. Dan Wilson, LBC.
Thank you, Health Minister. You picked up a few moments ago on international travel. Obviously, in England, people are free if they want, certainly, to travel to green list countries. The advice here, as you mentioned, is to avoid all but essential travel abroad. When do you envisage that advice to change? The First Minister said to us last week, or seemed to be hinting, that the advice this year could be just to stay in Wales. And if that is the case, what do you say to those in the travel industry who are facing a second summer season of essentially being wiped out?
I think we recognise that this is a really, really difficult time, but I would ask people to look at the broader picture, and that is how our whole economy could come to a grinding standstill again if we were to let new variants take hold. So we've also got to consider that actually the tourism industry in Wales has an opportunity to recover, and I see our responsibility as a government to stand by our own tourism sector and our hospitality sector. So, you know, we live in a fantastically beautiful country, and I would encourage people to use the opportunity to holiday here in Wales and to support those sectors of the economy that have really suffered during the pandemic.
Thank you. And there has also been reports over the weekend that Boris Johnson had been skipping emergency COVID meetings with the devolved administrations to allegedly write on a book. The Welsh Government has spoke time and time again on the difficulties it's had in its communication with Number 10 in the last 15 months. Can I ask what you make of those accusations? And regardless of whether they're true or not, the fact that you've had more cooperation with Michael Gove, do you see the Prime Minister's lack of engagement as in any way harming the way that the devolved administrations have been able to work together and deal with the pandemic collectively?
Well, I know after the election that the First Minister wrote to the Prime Minister of the United Kingdom. We're very keen and anxious to, where possible, work together. But we do have a constant dialogue with people like Michael Gove, with Matt Hancock. So there is a communication there. But of course, we need to make sure that there is a more structured dialogue that is held, and that's what we've been calling for since certainly a very long time now. We would like to see that pattern be introduced on a consistent basis. Owain Clark, BBC.
Around chi. This is a question for you both, and could I please ask Gweinidog Iechyd i ateb yn y ddwy iaith os yn bosib. Bringing it back to the India variant, obviously you mentioned a rise in numbers, but the study over the weekend, Public Health England study, showing too that you really need 2 doses to get a decent level of protection against it. In terms of the advice that you give or the advice that you receive, would it make more sense perhaps to be very cautious, even more cautious than the timetable allows now, up until the point where you have more people having had second shots?
Frank, would you like to take that first?
Yeah, you're right, Owen, that 2 doses of vaccine gives a far better protection than 1, particularly with the India variant, so-called India variant. And that's why, as the Minister says, we've given very clear flexibilities to local IMTs that where we do have cases of the virus being identified, they have the ability to move their vaccine supplies around and to provide second vaccine doses earlier in areas of concern if necessary. But you're right in your point that, if I understood it, Owain, that getting the population fully vaccinated is it's our way towards reopening our future, really. And so the question about international travel, by July we will have a much clearer understanding of, first of all, what our vaccination status is, and all adult populations should be vaccinated by the end of July. We expect that. We'll also have a much clearer idea of what's happening in the rest of Europe and in other countries, travel destinations that people from Wales would like to go to. So I think, by the end of the summer, by the end of July, we should have a much clearer understanding and a better ability to advise the public on what is and is not sensible.
I think the other thing to bear in mind, Owen, is that actually we're so far ahead when it comes to the vaccine programme that at this point we don't feel like we need to make any clear adjustments with the very low levels within our community. But obviously we will keep a very close eye on those rising numbers of the Indian variant and what that means for our community transmission. So we're not there yet, but we will keep an eye on things. And if we need to do some surge testing, some surge vaccinations, we will certainly do that.
Yn Gymraeg, os bosib, ar yna?
Wrth gwrs, mae yn bwysig ein bod ni yn deall fod na gyfrifoldeb ar pobl i gael y vaccines sydd ar gael iddyn nhw. Wrth gwrs, wrth bod yr ymlediad tu fewn y cymunedau mor isel ar hyn o bryd, a'r ffaith ein bod ni mor bell ymlaen o ran sicrhau bod pobl wedi cael eu vaccinations nhw. Ar hyn o bryd, ni ddim yn gweld eisiau ag angen i ni gynyddu y niferoedd sydd yn dod ymlaen yn gynharach, ond wrth gwrs mi gadw ni meddwl agored ynglyn â hyn wrth bod ni'n gweld cynnydd yn y niferoedd yna o'r amrywiolyn newydd o India.
Diolch yn fawr iawn. And could I also ask you briefly to mention, perhaps in both languages, sorry again, the position today with the relaxation of visiting restrictions for care home. What difference do you think that would make? Have you made any assessment in terms of the impact that separation has had on the most vulnerable people while those restrictions have been enforced? And we are still hearing from the sector a little bit of caution, perhaps, in terms of, talking about needing more manpower and resources to make this safe. Could I have a response on that, please?
Certainly, people will have seen that today we're bringing in new rules so that it's easier to visit care homes. We would ask people, of course, to follow the guidance that has been set by the individual care homes, and we've set down some very strict rules around that. But I think we do recognise that, in particular, people who are suffering with dementia, who are living with dementia in those care homes, that they have undergone a very, very difficult year. and they may have lost connections with the people who they're closest to. And so we were very anxious to open the possibility for more people to be able to visit their loved ones in care homes. The fact that we've got so many people within these care homes now vaccinated means that we think we've got a degree of protection that should be protective of the care homes, and obviously the people going to visit, as many of those as possible, we hope will have also been vaccinated. So we're confident that we're doing the right thing here. We've always got to get the balance right between protection and those other harms that come in people's way, in particular when it comes to mental health. Cys fi ateb hwnna yn Gymraeg hefyd. Heddiw wrth gwrs i ni yn llacio y cyfyngiadau sydd ar cartrefi gofal. Bydd mwy o gyfle gan bobl i ymweld a chanolfannau cartrefi gofal. Ac wrth gwrs mae'n bwysig bod pobl yn cymryd camau ac yn dilyn y canllawiau sydd wedi ei rhoi ger bron cartrefi gofal yma. I ni'n hyderus bod canran uchel iawn o bobl yn y cartrefi gofal yma nawr wedi derbyn y vaccin, ac felly i ni yn obeithiol bydd y pwynt a'r perygl o gweld ymlediad tu fewn y cartrefi gofal yna yn isel iawn. I ni'n ymwybodol hefyd bod na achosion eraill o niwed, nid just y virus, a mae pobl yn diodde'n arbennig o dementia, a mae pobl wedi colli cyfle i weld y pobl maen nhw'n caru yn y cartrefi gofal yma. Felly, ni'n awyddus iawn i weld bod cyfle gan bobl i weld y pobl maen nhw'n caru yn agos. Rob Taylor, Wrexham.com.
Good afternoon, Minister. With the North Wales Health Board recently emerging from special measures and now having to deal with the COVID backlog, have you spoken with senior management there since taking up your new role? And if so, what was your message to them on your expectations? And if it's possible to put a question to Dr. Atherton as well, you've touched on it earlier, but with the first issues in Bolton surfacing a couple of weeks ago now around the Indian variant, early commentary was that it was of immediate concern. Are your latest figures tempering that concern, or is it still an urgent issue?
Thanks very much, Rob. I did have the opportunity to speak to all of the heads of the health boards last week. My message was very clear to them that we're not out of the pandemic, but that we have a huge task ahead of us in terms of rebuilding the NHS. I haven't had a chance to speak directly to Betsy Cynhadledd heads yet. I've only been in the post for a week, but of course I'm very aware that they have only recently come out of special measures, and that we have a responsibility to monitor them very closely as they enter this new phase of development. You'll be aware that we injected a huge amount of cash to help them to get to a better position in Betsy Cynhadledd, and we hope with the new Chief Executive in Betsy Cynhadledd that we will see a fresh look at the way that we can provide services in that part of the world.
Rob, on the question of the northwest in general, northwest of England in general, and Bolton, Blackburn in particular, they clearly are hotspots in England where there is widespread community transmission, and of course there are extensive travel links between the northwest of England and the northeast of Wales. We absolutely know that, in the same way as we have links down in the southwest of England into the AB Health Board. And so, of course, it is a concern, and we're watching very closely. I talk regularly with my counterparts in England about what's happening in England in general, but in the northwest in particular. And we are watching very closely the hospitalisation rates, particularly in Bolton Royal Infirmary, where there has been a slight increase, but not a massive increase. We're not seeing in any of our Welsh hospitals at the moment any increase in case numbers or in severity or in people adversely affected. So it's a watch with caution approach at the moment as we understand what's happening in England. I think we have a slightly fortunate position in that we're probably a couple of weeks behind England. So although I say I expect numbers of the variant to increase, we will get a clearer view from across England and indeed in Scotland as to what exactly is going on, and that will help to inform our decision making here.
Thank you. And Minister, business support's been previously announced, partially backdated, and is a £66 million out of a £200 million pot. Is there any indication of when the rest of the money will be released? Will there be restart grants as well, and any further payments to businesses affected, and will that be done quite promptly? And for Dr. Atherton, has there been any uptick in case figures or other data linked to any specific sector reopening?
Thanks. First of all, on the business support side of things, of course, the thing that businesses really wanted is to reopen, and so I'm really pleased that we've managed to get to that position. Vaughan Gethin, the new Economy Minister, I know is looking at this as a matter of urgency. We're aware that there are lots of people who still need support, but I would urge those businesses who haven't applied yet for that support to get their skates on, that there are opportunities there for them to get support. But as we say, we've only allocated a certain amount of that 200 million pot, so there will be more to come.
Your second question, Rob, the answer is, case rates here in Wales are low and stable. We're not seeing any increase in the rates overall, and we're not seeing any specific issues. We continue to identify sporadic cases and small clusters, and our incident management teams manage those.
And last question from Jez Hemming.
Good afternoon. Both first questions for Dr. Atherton. Dr. Atherton, what measures would you take if the situation regarding the Indian variant, should I say, worsens? And more importantly, what is the trigger point for bringing in those measures?
Well, a lot depends on what happens. So if the numbers go up, Jez, that's a worry, obviously, because higher rates we've seen over the course of the pandemic can lead to increased hospitalisation. What we just don't know is, how much an increase in the rates of a new variant here in Wales would lead to increase in hospital admissions, increase in people needing intensive care units, and increase in deaths. And so, as I say, we need to kind of see what happens, what the picture is over the next few weeks in England, really. There's no hard and fast trigger that would make me say we need to bring in further restrictions or reintroduce restrictions. But obviously, if things start to go awry with people needing hospitalisation, then that's something that ministers would have to look at very hard again. But again, it's always a question, of course, of weighing the direct harms from coronavirus, as we've said many times, against the indirect harms. And we are now in a fortunate position where the overall rates are quite low. We are able to reopen many elements of our society, and the last thing any of us want to do is to go back, to retreat and to have to go back to further restrictions. And the way to avoid that is for us all to behave sensibly, to do those things which we've learned, keep us all safe. So we're grateful to the Welsh public for what they've done in getting us out of the wave of coronavirus infection that we saw over the winter months, and let's not waste it now. Let's just keep ourselves safe.
Minister, I was at Betsy Cadwallader's health board meeting the other day where auditors had said they hadn't got their governance together for mental health strategy right and had to go back to the drawing board. And that was after 4 years. Now, this was supposed to be getting better because the board was moved into targeted intervention from special measures last November. So my question is, will you commit to greater transparency than your predecessor on how you calculate whether interventions are escalated or de-escalated in future?
Thanks very much. I'm aware from my previous role as Mental Health Minister that there were still many outstanding issues in relation to mental health issues in Betsy Cadwallader. That targeted intervention means that we are still monitoring things very, very closely from a Welsh Government point of view. Of course, I want to be as open, as transparent as I can be. I need to have an early discussion with the Chief Executive of the Health Board just to make sure that we understand they understand what our expectations are in terms of improving the service in North Wales. The service has obviously been under a huge amount of strain, but as you say, there has been a long time now where we've been in a very difficult situation, in particular when it comes to mental health support in North Wales. So I will continue to keep an eye on that, as I'm sure Lynn Neagle, as the Mental Health Minister, will do. Diolch yn fawr iawn i chi gyd.